More than 26 million infected around the world. Hundreds of thousands have died. That's a World War type of scenario. World War casualty figures.
The first case of COVID-19 emerges in Wuhan, China in November 2019. In January 2020, Singapore confirms its first case of the novel coronavirus. The fight against what will become a global pandemic is about to get tougher and last much longer than healthcare workers can even imagine.
Overnight, we saw 3 times more Singaporeans coming to our screening center.
My 20-bedded ward just transformed into a 40-bedded ward. We called it the most terrible Monday because we saw 520 cases. I didn't sleep that day.
How do I feel? One word sums it up: tired.
Tock Seng Hospital is one of Singapore's largest multidisciplinary hospitals. Next door, under the same management, is the National Centre for Infectious Diseases, which officially opened its doors just 4 months before the biggest public health crisis in the recent history of the city-state. Over the course of 8 months in 2020, both will screen a total of more than 35,000 people for COVID-19 and ward thousands of infected cases. Almost every single staff member will be pulled into the war on the virus. And it starts like this.
On the 30th of December, there was reports from China that there were a cluster of atypical pneumonia happening in Wuhan, and the cause of it is unknown. That signals that there could be something unusual happening, and it's something that we need to watch closely for.
Dr. Angela Chow heads the Department of Clinical Epidemiology at NCID. One of its tasks is to look out for data on infectious disease trends around the world.
So every day they were monitoring for diseases very closely. The MERS and avian influenza. And it also tells you where the countries, the areas where there are active transmission of these diseases.
3 days after the news from China, Singapore begins to screen all inbound travellers from Wuhan. Although the cause of the outbreak there is still unclear, TTSH and NCID go into full outbreak mode.
It was never, at any point in time, in doubt in our mind that it will spare Singapore.
Professor Leo E. Sin was at the forefront of Singapore's fight against the Severe Acute Respiratory Syndrome outbreak in the early 2000s, which claimed 33 lives. 2 of them were her colleagues at TTSH.
A very painful experience taught us that our systems need to be ready.
In the SARS aftermath, the hospital developed a comprehensive outbreak playbook. Every staff is assigned a role to play in the event of an outbreak, and hospital-wide drills are conducted at least once a year.
Planning is an essential part of our state of readiness. It makes an outbreak a known unknown.
Realistically speaking, how long do you think triaging will take?
10 to 15 minutes.
Dr. Ang Hao, who joined the hospital shortly before the SARS outbreak, now leads its emergency department, which is Singapore's largest and busiest.
The emergency department has a long-established history of running screening for outbreaks.
During peacetime, we already screened for MERS, yellow fever, monkeypox, Ebola, plague, Lassa fever, and now COVID-19. This is new.
Working closely with Dr. Ang is Dr. Charmaine Manawis, who develops the instructions for healthcare staff to screen patients.
There was a particular period where we had to screen for certain provinces in China. So of course, everyone isn't versed on where the provinces are. So that's why they put the map here. Once we pick up a travel to these certain countries, then they are triaged to the fever area.
4 days after screening begins, NCID opens its first outbreak ward to isolate suspect patients. Margaret Soon is its nursing director with almost 30 years of experience.
The initial cases definitely is with a lot of anxiety. Because we know very little, we also could tell the staff very little.
It's a tense period. On January 8, Chinese officials identify a new coronavirus that's related to SARS and MERS as the cause of the epidemic. A day later, its genome is made public. Scientists in Singapore begin their race to develop a test kit. Among them is a team comprising staff from TTSH and the Agency for Science, Technology and Research.
So when the first case arrived, we could use our own in-house detection kits to be able to make the diagnosis.
In China, the virus has spread from Wuhan to other parts of the Hubei province. People begin to die from the infection and medical workers are contracting the disease in the line of duty. In Singapore, TTSH isn't taking chances with the safety of its staff. Its infection control team ensures that everyone, from doctors to cleaners, is properly trained and equipped to protect themselves.
Right? So when you are done, you have to do a fit check to ensure that there is no air leak in the mask.
These strict protocols have been meticulously developed over the years by Dr. Brenda Ang, another SARS veteran.
The role of infection control is to limit the spread between patients and also to try and prevent transmission to healthcare workers.
Even contractors are mask-fitted. Over the rest of January, cases emerge elsewhere around Asia. On January 23rd, the same day the Chinese government put cities in Hubei under lockdown, Singapore confirms its first case. A 66-year-old Chinese national from Wuhan, who is warded at the Singapore General Hospital. The day after, case number 2 is confirmed, this time at NCID.
It was actually a tourist from Wuhan, so of course she couldn't quite remember where she's been, what she's done.
Finding out where she'd been and who she'd met is the job of Dr. Chow's team. In the weeks to come, the role of thorough contact tracing will become even more apparent as more is learned about when and how infected persons transmit the virus.
From the point when they are symptomatic, we look back one incubation period, so 14 days. The history can go back like 2-3 weeks. A lot of time to slowly jot their memories to recall.
Where did you go with your daughter?
Here, there. I think Sunday, she drove me,
Of course, there are people who have rather active social lives. That is definitely good. It's a bit more challenging when we are trying to do the contact tracing. To know exactly where are the places that you went to and what times you went to.
As more close contacts of infected patients are identified, the screening load at the emergency department increases. TTSH decides to activate the dedicated Infectious Disease Screening Center at NCID.
It was a very busy Chinese New Year for a lot of people, not because we were going around celebrating. Furniture had to be moved in, computers had to be set up. We actually managed to cut 2 days off the activation time.
More nurses are also needed to triage and swab patients.
We have to draw nurses from various areas, including nurses from operating theatres, the clinics, our nurse educators. Some of them volunteered. Actually, the whole kampong is involved.
So this is my night shift. Let's go and have a look.
Yu Yong, a nurse at the cardiology department, is one of the volunteers.
We practice and we do the swab on each other. I tell you, you won't think about doing it again.
So far, all confirmed cases here have been travelers from China.
Singapore will restrict entry to all new travelers who've been to mainland China in the last 14 days, regardless of nationality.
But on February 4th, the inevitable happens. A cluster of infections emerges from a Chinese medical hall serving tourists from China. The 4 cases signal the start of community spread in Singapore. It also sparks a change in the definition of a suspect case to anyone with recent close contact with travelers from China.
Taxi drivers, tour bus drivers, people who worked in tourist attractions or hotels and airports, casinos, they were all flooding in that day.
It was 3 times more than what we saw the day before.
The task of making sure they stay ahead of this massive surge in demand falls to this place.
Welcome to the command center of Tock Seng Hospital. This is where we have visibility of the entire operations in Tock Seng Hospital and the National Center for Infectious Diseases.
This military-inspired command and control center is the first of its kind in a local healthcare facility. It's overseen by Dr. Jamie Lim, the hospital's chief operating officer.
The screen gives us visibility of the supplies that we have at the screening center. How many patients do we have at that point in time? We use colors to depict status. When it crosses a certain threshold, it either turns yellow, amber, and then the next threshold would be red. We don't want to be reactive, but we want to be ahead of the signs and signals.
On that pivotal night of February 4th,
C3 system triggered an alarm. In a span of 24 hours, we opened up an additional 5 wards.
We had to open 100 beds within a day. That was really stressful. There's just a lot of coordination to making sure that the medications are there, linen is there.
But when the beds fill up quickly with suspect cases who present as clinically well, the team proposes a new strategy. NCID Clinical Director Sean Vasu keeps the Health Ministry updated regularly.
We propose to the Ministry a swap and send home strategy where patients who do not need hospital care would receive that diagnostic test, an adequate amount of medical leave to go home and self-isolate till the results come out within the next 8 to 24 hours.
At home, these patients are closely monitored by the surveillance team to see if they develop symptoms. Those who test positive are brought in straight away by ambulance for admission to NCID.
We have also trained up our data analysts, our biostatisticians, pathologists, our psychologists. They were helping us with phone surveillance.
Soon, as the patient load increases, as many as 50 staff are roped in to call more than 500 people a day as part of surveillance and contact tracing efforts. Another team working round the clock in the background is the Department of Laboratory Medicine, led by Dr. Partha Day.
And very quickly it had to go to 24/7 operation from normal office hours.
So right now I'm labeling the samples that we will be extracting for the next run of extraction.
They are another crucial link in the chain, racing to provide timely confirmation of whether a suspected case has been infected or not.
Even a negative result enables the doctors and nurses to discharge patients and free up beds for the new incoming suspect and confirmed cases.
Almost every half an hour there will be samples coming in. My busiest night, throughout the night from 8:30 to the next morning 8:30, I didn't even have time to rest. It was continuous running of samples.
The team uses the test kit developed by scientists from TTSH and A*STAR, made available to hospitals on February 6th. And it comes none too soon. The next day, Singapore raises its disease outbreak response system condition to orange alert level.
The disease spreads easily among people, but is contained and not widespread.
Visitors to hospitals will now have to fill in declaration forms and have the temperature taken. Staff are redeployed here from other departments. To make this possible and as a safety measure, the hospital cuts down on elective surgeries and closes some clinics.
I came from acupuncture clinic. From business office?
So I'm from community health department.
Some staff, like dietetic technician Collis Yap, now work 12-hour shifts instead of normal working hours.
At first it's very draining. My family members always remind me why I do this and why is it important.
Thank you very much for coming on a Saturday.
Other medical staff are directed to support the screening center and outbreak wards.
Obviously, we needed more manpower. The whole hospital had to cut down on leave and off days.
In fact, I was planning for my honeymoon, but it got cancelled.
and I came back to NCID to care for my patients.
But on social media, accounts are shared of ambulance drivers and nurses being shunned on public transport and in public areas. This paranoia, however, triggers the unexpected, an overwhelming flood of love and encouragement for healthcare workers.
So we've received a lot of stuff from kids and from the public. So this one is from Little Footprints Preschool. Look, they have the babies. These are the babies' footprints. And then the older kids wrote us letters. So it's very heartwarming.
Patients too express their gratitude. Mrs. Zhang spent most of her 18 days in NCID under intensive care.
我就记得那一天，我就觉得呼吸的特别困难，我就在想自己是不是快要死了。ICU 的那些医生护士们，他们行动很迅速，好像是有一位菲律宾医生，他一直捧着我的头跟我说：“你不要担心。” 我们马上给你插管，你放轻松，他会帮你呼吸的，你不要担心，他一直在安慰我。
Meanwhile, the virus continues to spread in the community and new clusters emerge. But the infection rate remains low compared to countries like Italy, and to some, it looks like life could soon return to normal in Singapore.
I suppose to the public, that may seem like a lull period, but that silence was very worrying for us.
Countries other than China go into lockdown, and WHO declares COVID-19 a pandemic.
We knew that it was a matter of time before we see the second wave. We didn't know how big the second wave was going to be, so we made a decision with the ministry to set up a tentage just outside the screening center if ever there is an overflow of patients coming in for screening.
The lab is also trying to ramp up its capacity from 500 to 800 tests a day with more staff and equipment. But its efforts are hampered by a global shortage of reagents. On March 21st, Singapore reports its first COVID-19 deaths. The ICU team is no stranger to dealing with mortality, but handling death from COVID-19 is different.
What you say is outside the ICU world. What we see is the reality and the sickest patient. Unfortunately, we do lose patients. Despite every effort we put, they still pass on.
That was very, very difficult for the families because none of them could come and see, and you had to tell them over the phone what was happening and that your father or mother or brother or sister was likely going to die.
You can imagine this is my loved ones. I would actually want to hold their hand to see Papa go by. We do have a relative actually fainted during the video call. We just feel a bit helpless. Yeah, but we try our best to do what we can to help the patient and the family. Everybody does that, in the ICU.
Well, Spain is now emerging as a new hotspot for COVID-19.
By March 22nd, the death toll worldwide from COVID-19 is more than 11,000, and in Singapore, infection numbers have crept back up, mainly from imported cases. For the first time ever, Singapore closes its borders to tourists and short-term visitors. The next day, Dr. Jamie Lim's fears come true.
We called it the most terrible Monday because we saw 520 cases. We actually had to open tentage until 3 a.m. at night with a lot of patients having to wait a little bit longer. So that was a struggle. I didn't sleep that day.
This surge in cases is due mainly to students and travelers returning home from countries going into lockdown.
I said, why suddenly so many patients? Yeah, then, never mind, we just chong out.
We are 80 people. If there's a job to do, then we just do it.
NCID immediately enacts its plan to expand the number of beds in the outbreak wards.
So let's move to 5F. Okay, we will go down to level 2.
The capacity here at baseline is 330 beds. We can expand the capacity to 586. The rooms in this building are designed in such a way that we can double stack or in some rooms triple stack.
But many of the beds are also being taken up by infected patients who are recovering well, and in the clinical team's view, can be cared for outside the hospital setting. At the national level, a decision is made.
There was a turning point in the outbreak in terms of our isolation strategies. This is where clinical data informs policy. We knew that clinical presentation, certain demographics about the patient, their age and their medical history.
Which means that we can now have younger COVID-19 cases being taken care of in the isolation facilities. And most of them would recover without significant complications.
Over a month, 3 more community isolation facilities are set up.
Well, all these are all like kind of drawer plans already in place?
Flexible. It may not be already in your drawer plan, but you must have a system where it is flexible enough so that it becomes situation-based and we can still respond effectively.
On March 29th, a porter who transports patients in NCID is confirmed to have contracted COVID-19. An outbreak within its walls would be any hospital's nightmare. It happened to TTSH during SARS when some 100 staff, visitors and patients were infected following exposure to the virus in its wards. But this time, nearly 20 years later, the hospital came prepared to the fight.
It's the end of my shift, so I'm going to be down.
And despite the more infectious nature of COVID-19, the stringent measures from personal protection protocols to staff surveillance have prevented disease transmission so far.
Now I can breathe again.
Everyone who enters into NCID wears this tag.
All patients and staff within NCID wear a real-time tracking device, which allows the staff surveillance team to quickly trace people who were in contact with the porter.
You can just open up all of them so you can actually see all of them have been in contact with every other people.
It provides granular level of visibility of where each patient is and where each staff is.
So this is the floor plan. It shows this porter's movement history on this date.
The information helps NCID to identify staff at risk of contracting the virus and to quarantine them to stem a potential hospital cluster.
You could say this is Big Brother watching you, but just say this is a friendly father, hospital observing people, again for staff safety.
This is a screening center, so a lot of movement happens in the screening center.
As of September 13th, 10 staff from TTSH and NCID have contracted COVID-19, but none in the course of their work. But elsewhere in Singapore, a time bomb is about to go off. The coronavirus has been quietly spreading among migrant workers.
This was the dormitory where the Bangladeshi worker stayed in before he tested positive for the virus.
Meanwhile, though nowhere at the levels of countries like the US or Italy, the number of unlinked community cases has crept up. On April 3rd, Prime Minister Lee Hsien Loong announces that Singapore will go into circuit breaker mode, closing schools and many workplaces.
We all have to take social distancing extremely seriously in this period, because this is the only effective way to slow the transmission of the virus.
We do not want to wait for a situation where the cases rise sharply and then we get overwhelmed.
The streets of Singapore have never been quieter, but the scene at TTSH is very different. Each day, up to 300 migrant workers come here to be screened.
The basic difference is that the migrant workers are unable to self-isolate because they live in a dorm. We will have to hold them until the swab results are out. If the patient is negative, then they have to be transferred to a clean dorm. If the swab results are positive, then they may be admitted or they may be transferred to isolation facility.
On April 20th, Singapore sees 1,426 new cases of COVID-19, the highest number so far in a single day. The majority of them are migrant workers.
I remember coming to work and overnight my 20-bedded ward just transformed into a 40-bedded ward because we have to increase our capacity just to cope with this increase of infection cases.
It was then that we saw some of the most sick patients. It was an emotional period for me personally because the patients that we see are usually fit young construction workers. They had to be hospitalized for quite some time.
Only I think about my family because how to say my life I can continue my life. I also very my inside very question mark ready.
Daily new cases of COVID-19 remain high throughout April, and NCID wards are almost fully occupied again, triggering its plan to expand into TTSH.
My name is Nadia. I'm an assistant nurse clinician here at Tock Seng, and I'm a nurse working in the COVID ward.
This is the first time where we have both COVID patients and business as usual patients in the same building. The first thing that we had to do is to make sure that the pathways are segregated. So that includes mapping of the routes and locking down the lift for the COVID pathways.
So these are the two areas that is actually designated to nurse our COVID patients. So let's go.
6 general wards there are converted into outbreak wards.
One ward is actually allocated to be the clean area.
The first shift is like, you go in, right? It's not even 5 minutes, you are like wet everywhere. And then you feel like so stuffy, and then you have this like fainting spells. Like you cannot breathe so well.
Every cubicle, there will be 3 big exhaust fans. This is actually to create negative pressure because the cubicle doesn't have an extra glass doors or an extra room.
Finally, after 8 weeks of circuit breaker, the rate of infection starts to slow. With the reduced COVID-19 patient load, the additional outbreak wards at TTSH are no longer needed. But for one department, there is no easing up.
In fact, our workload on microbiology for PCR has gone up a lot more. It's doubled.
To cope, the department hires additional staff and acquires new equipment that simplifies the testing process.
So people who need to be cleared to go back to work, like school teachers, goods delivery drivers, essential goods like groceries and so on. The emphasis has shifted to screening, which is a good thing, which is part of reopening. COVID-19 will eventually become the new normal respiratory virus that we will test for every year, just as swine flu, H1N1.
On July 14th, the lab makes a mistake.
A confirmed case of COVID-19 has been found to be wrongly diagnosed due to a mix-up of test samples at the Tock Seng Hospital's laboratory.
To ensure that a mistake like this doesn't happen again, the lab has automated its patient registration process.
I've got 1,000 specimens to process. Even if we tell them, take your time, they know there are patients waiting at the end of this and they want to do their best. So we've had to try and manage all of that, the psychological as well as the physical demands.
While the hospital still isn't going back to 100% business as usual, it has managed to resume some elective surgeries and open certain clinics. Other inpatient wards have also continued to run all this while, compared to SARS when TTSH was designated the central treatment hospital and closed to all non-SARS patients.
In an outbreak People still come in with a heart attack, people still break their leg and they need treatment. Emergency surgeries will still carry on. We run essentially 2 hospitals. Tock Seng as the business as usual and NCID as the outbreak center. With the same team of doctors, nurses and administrators.
Can you just page for me if there's any problem? I will be in the office.
Okay, got it.
Okay. Meeting.
Did not really reduce the nurse-patient ratio, either at BAU side and also at NCID side. We deliberately planned for the ratio to be at 1:4, especially because we think that adequate staffing is important for both patient and staff safety.
But the months-long fight has taken a mental and emotional toll on staff, and the war with COVID-19 is a long way from over.
There's one day my husband actually come back from work having high fever. I'm not scared for myself. I really scared for my loved ones. And what I don't want is because of me, he got COVID. That is actually something really made me emotional at that period.
I realized that running the screening center takes a lot of effort, and each of the different family groups contribute so much. Okay, wait. Yeah, it's been tiring, this one. Sorry.
Everybody has been pulling together, responding to this terrible pandemic. You do a fantastic job, not just during the pandemic, you do a fantastic job all day, every day.
I'm tremendously proud of my colleagues. They are marvelous, they are kind-hearted, and they really give the best in their care.
I think so far Singapore has coped reasonably well, and that again is the work of the entire healthcare system, the ability to respond to the challenge. However, I think we shouldn't be complacent, because I think the road ahead is still long and winding.